Welcome to the Mental Health Treatment Guidelines webinar series. This is the first webinar in the series and is titled Voices of Lived Experience, the Importance of Trauma-Informed Mental Health Care for Youth Impacted by Trafficking. This webinar is brought to you by the National Center on Child Trafficking. The NCCT is a national collaborative of professionals who are developing trauma-informed interventions and resources to improve the lives of children and families impacted by sex and labor trafficking. And one of our primary aims is to support you, the professionals who serve these youth. The Mental Health Treatment Guidelines webinar series includes 8 webinars, with each presentation focusing on a different aspect of mental health care for youth impacted by trafficking or exploitation. So nothing about us without us. This is a saying that's over 500 years old, and it means that no policies that affect a certain group should be determined without full and direct involvement of members of that group. It was originally applied in English through disability activism, and it's expanded to other marginalized groups, such as survivors of trafficking. This webinar series begins and concludes with the voices of those with lived experience of trafficking or exploitation to reflect this core value of the NCCT. And with that being said, I'd like to welcome our presenters today. We have Dr. Rachel Nemec. She's a board-certified family nurse practitioner. She's a coordinator of the Family Nurse Practitioner track at UMass Medical School and a member of the training team at My Life, My Choice. Rachel previously worked as a pediatric sexual assault nurse examiner as part of a multidisciplinary response to child sexual abuse and exploitation at children's advocacy centers. As a survivor of CSEC, she's committed to using her lived and professional experience to help service providers respond compassionately to victims and survivors as they navigate our complex systems. We'd also like to welcome Evelyn Chumbo. Evelyn is a survivor of child labor trafficking turned anti-trafficking activist and public speaker. She's the operations director and survivor leadership director at the Human Trafficking Legal Center, has briefed government agencies about human trafficking from a survivor's perspective, and raises awareness in communities to create employment opportunities for trafficking survivors. We're not sure if Nathan's going to be able to join us today, but Nathan Earl is the principal consultant at Giant Slayer Communications. He leverages more than 20 years of lived and professional experience to help organizations and communities prevent violence against boys and male-identifying individuals, including leading one of the first direct service programs for male survivors of human trafficking in the country. Nathan consults with federal, state, and NGO partners, was a 2019 fellow of HHS's Human Trafficking Leadership Academy, and is currently pursuing a master's degree in public health at Yale University. And we will see if he is able to join us. Jessa Dillow-Crisp is the co-founder and former CEO of Bridge Hope. Jessa has a master's degree in clinical mental health counseling, is a nationally certified counselor and licensed professional clinical counselor in Colorado, and is working towards her PhD in counselor education and supervision. As a lived experience expert, Jessa has been a consultant for OVC TTAC, the Blue Campaign, Polaris Project, and the Department of State, among others. Thank you so much for all of you for joining us today. We're really excited to hear from you and excited about this webinar. So we're going to be focusing today on our presenters' perspectives on the importance of a trauma-informed approach within mental health care for youth and families impacted by trafficking and exploitation. According to SAMHSA, a trauma-informed approach has these 4 R's. It realizes the widespread impact of trauma and understands potential paths for recovery, recognizes the signs and symptoms of trauma in clients, families, and others in the system. It responds by fully integrating trauma knowledge into all aspects of care, including policies, procedures, and practices, and seeks to actively resist re-traumatization. And these are the 6 principles of a trauma-informed approach. We're familiar with many of these, but we're going to be really asking our speakers to explore each of these areas in a little bit more depth. So just as a review, safety in a trauma-informed approach, providers work with youth and families to understand, what does safety mean to you? So it emphasizes not only physical safety, but also psychological safety, which can involve anything from physical interactions, physical setting, or any other kind of interactions with the young person and their family members. So I want to open up this area for reflection by our presenters on how clinicians can support physical and emotional safety for these youth. So first, why is this topic important for youth who've experienced trafficking or exploitation? What can a therapist do, anything from their physical space to their general approach, that would either increase or decrease a person's sense of safety? And then also knowing that youth impacted by trafficking and exploitation often face safety concerns, what recommendations would you have for therapists in responding to those concerns? So I'm going to hand it over to Rachel Nemec. Do you want to go ahead and start us off, Rachel?
Sure. Thanks, Elise. And thank you all for being here today. I think this is a really important place to start. I think safety really sets the tone and sort of the vibe for working with people, not only individuals who have experienced complex trauma, but specifically for young people who have experienced sort of that transactional nature of trafficking. And that's something really unique about their trauma. And so I think, it may seem intuitive to think about safety as sort of the way we create our spaces and, psychological safety by, making sure that we're paying attention to our body language and also monitoring sort of the trauma responses, the behavioral responses from people who have experienced trauma. But I think some things that are unique and important for folks who have experienced trafficking is understanding as a clinician that, every situation that we had been involved in at one time or another as part of our trafficking experience, most likely felt rather transactional. And so we had to do something in exchange for something else, which meant a lot of times that even though there was harm and even though the rules of engagement were harmful, there were often rules of engagement, right? So there were ways that we knew we had to show up, down to what our names were, what we were wearing, what we were directed to do. And while that didn't minimize the trauma, it created sort of that space of understanding what the rules were. And so from a very real perspective as a provider, understanding that sometimes that's the piece that creates a lot of angst for survivors, is not knowing what's the expectation of me in this space. What do I have to do in order to get anything, right? Or what do I have to do to stay safe? And so, I know we'll talk a little bit about sort of that transparency and the importance of that transparency and trust as we go along today together. But really paying attention to that might mean going out of your way to sort of set the tone for what is going to happen today in this space. What's my expectation of you? Because as a survivor, I can recall walking into spaces, therapeutic spaces, thinking to myself, is the expectation that I'm just supposed to tell you every bad thing that's ever happened to me? Because that doesn't feel safe. Or if that's what I'm supposed to do, because it's going to help me heal, can we have some guidance, some parameters around what that can look like? And so just being mindful of that. I think the other unique thing about working with survivors of trafficking is that not only will we tend to be, hypervigilant and on alert behaviorally, but the very real reality is that for a lot of us, the folks who purchase access to our bodies looked like, acted like, very, very much at times were the very providers that were there providing support, right? Or supposed to be providing support. And so as a therapist, you might be there thinking, I'm here to help this person. I'm a safe person. But we operate from a space of nobody is a safe person, right? Nobody is a safe person. And this person, this judge, this lawyer, this police officer, this teacher, this therapist, who I think is supposed to be a safe person, is also purchasing access to my body. And so while you may be not someone who is there to cause harm or not someone who is there to purchase access to our body, you may look very much like the folks who did, right? And so to understand that that's not personal, that our viewpoint of the world is, I'm not going to trust you until I know I can trust you. And even then, probably still won't trust you. But but being mindful that you could very well represent folks who have caused us very, very real harm, physically and or otherwise. And so just being mindful of that power dynamic from the start. And we're going to talk about ways that like sort of dispel some of that to begin with, right? Transparency and trust being one of those.
Jess, do you want to add a little bit to that?
Yeah, sure. So as a clinician, but also as a lived experience expert, clinicians hold a lot of power. And Rachel, I'm just so grateful for the things that you highlighted and the ways that we can go ahead and very much remind the people that we are trying to help, the youth that have experienced exploitation of people who have purchased them, people who have created a lot of harm. So I really think that there's such a need for us as clinicians to create a space of mutuality within our clients. And so when youth come into my office specifically, one of the things that I do with them is I give them the agency to go ahead and change whatever they need to change in that office, to go ahead and help create feelings of safety. And I'm going to highlight for some survivors of exploitation and trafficking, the word safe or safety can actually be a trigger word. So just to have awareness of that. When youth come in, I don't go, oh, do whatever you want to make this room safe. Instead, I just go ahead and invite them to go ahead and, is there anything in here that would feel better if it was changed? Or would you, and something that I love doing is actually giving youth stickers and letting them to go ahead and put that wherever they want in the office. And so I have a sticker on a picture frame, and it's just a little sticker, but every single time that youth comes in, that youth looks at it and goes, oh, my sticker is still there. And I'm like, yes, your sticker is still here. And guess what? I've been thinking about you, and I am so glad that you are here today. And so being able to go ahead and invite them to co-create this space. Mutuality is something, like I said, we're going to talk about, but it does connect to safety. It does connect to physical safety, also to emotional safety. And that is something that is so vital to be able to develop. And one of the things is a person may physically, because of the way that the nervous system has been so harmed due to the trauma, the nervous system might be what is having trouble in that room. And so I love to go ahead and just spend time just having fun and getting to know the youth who have experienced exploitation that I work with, and try to help build memories and do so apart from talking about the trauma. And did you know that talking in the therapeutic space, that's not even talking about trauma, is still doing trauma work? And I think that's one of the things that a lot of clinicians think, oh, we need to go in and we need to start talking about all this deep stuff. And very first session, we're going to start to open everything up. Honestly, I have spent several years for some of the clients that I've been working with, and we still haven't yet started to talk about the trafficking that took place, but I'm building attachment. I'm helping the autonomic nervous system go into that ventral vagal state through connection, and I'm able to go ahead and help there be a place of safety ultimately. Rupture and repair is part of that. And for instance, I actually had one client go ahead and give me a plant, and y'all, like, I'm bad with plants and I killed it totally by accident. But being able to go ahead and build repair through this process of the plant was actually something that ended up being so therapeutically beneficial. And so just being able to go ahead and build that safe relationship.
Those are such great points. And I think we're going to, for each of these, give a few key takeaways. So just to recap a couple of the things that you're saying. So youth impacted by trafficking and exploitation have really been taught through repeated experience to expect harm from other people. So they have challenges in that felt sense of safety in the world in general, and then in relationship with other people. And Rachel, your point about, the professionals are some of the people who have been involved in the exploitation. And so to keep that in mind, that we may be triggering just by being a professional. And And also that therapists need to understand this and then take specific steps to build safety. So I love that, Jess, some of the ideas that you had about even your physical space and what you might do with that. Even creating expectations about what therapy is and what you can expect from it. Just having a warm and inviting, accepting physical space, and then your attitude towards the person to have that be consistent and reliable. Some of the things we'll be talking about. And then in terms of some of the concrete safety concerns, just working really collaboratively with the young person to define what is physical and emotional safety, anticipating potential threats, trying to avoid and minimize harms, but then when harms do happen or there are safety concerns, working collaboratively to kind of address that. So those are great points, and this safety is going to sort of feed us throughout. So trustworthiness and transparency is our second principle of a trauma-informed approach. And so a few questions here. First, why is the principle of trustworthiness and transparency so important for youth who've experienced trafficking or exploitation? What are some of the pitfalls that therapists might encounter with this? What they might they do or say that could interfere with trust building? And then in contrast, what can they do or say that might help with showing that they are trustworthy? Evelyn, do you want to start us off and take this first?
Sure. Thank you. So just to echo a little bit of what Rachel and Jess said, I think you guys touch a little bit on the trust part in regards to safety. So of course, safety is 100% important, and trustworthiness is, and transparency is important. For me, I believe in transparency, especially as a survivor of child forced labor. It is important that we build trust, because trust has been taken away. So if I'm going to see a therapy, first, of course, I need to understand what a therapist is. I always say that, because trafficking situation happen from people from different background. And I know we're going to touch on the cultural lens of this, but when it comes to trustworthiness and when it comes to trustworthiness and transparency, I feel the therapy needs to have that human connection with the person, and also have to understand that each person's healing journey is different. And even though most of us all of us might be a victim of human trafficking, survivor of human trafficking, but our experience were probably different. Like in my case, I came at age 9, taking care of a kid. I became a mother at such a young age. And, the reason why trust is so important, because I was promised all these things that I would come to the US to obtain, but that was not the case. So a lot of the times, traffickers make false promises, and then you don't get what you got into. So it is so important, especially as youths. Sometimes we feel like youths don't know much, or we want to just insert our own belief and our own way to them. But it's good to talk to them, to kind of find out and to give them a reason to really trust you. And that's why transparency is important, because really I like to say, keep it real. Be real with them, because sometimes youths can feel bullshit. They can feel like, hey, I'm just, you're just here. And try not to use like big words. A lot of the times, if you want to be that trustworthiness and transparency, please try not to use big terminology words that some of us don't know. I know, you're a doctor and things like that, but using such words gets us confused. Like, what are you saying? So it is so important. And then, the last question, how can therapists show trustworthy? You can show trustworthiness by just being a human. We know that it's a job. We know that you are a therapist, and we know that there are certain rules you got to follow. But first rule when it comes to a survivor of trafficking is to have compassion. is to have compassion. If you truly want to help them through their healing and build that trustworthiness with them, be a human, because don't forget also, a lot of times we forget that we were once youths and we became adults. I say that because I'm raising a human being, so I know it's not easy. Sometimes I forget, oh, I used to do that at his age. So please be a human first to build that trustworthiness and just show compassion.
That's great. Rachel, you want to add a little?
Yeah, I think, Evelyn, I loved how you talked about just being real, which I think sometimes as a provider myself, we're sort of like conditioned not to be that. We're sort of taught to like have this level of removal from the folks that we're providing service to, because that's what professionalism is. And I think while that's I think there's a good intention there, but sometimes that can make us also as providers come off as a little bit cold and a little bit stale and removed, right, from that human experience. And as folks who have had to navigate our lives responding to very unsafe situations and very unsafe people, and having to figure out what are the rules that I need to do, what are the things I need to do to keep myself safe, means that's those are some of the skills that we're going to continue using until we feel like we don't have to do that anymore. And so transparency is helpful in that way, that like I can stop having to scan the room. I can stop having to scan your face and figure out how I need to respond in response to you, right? One of our skills, and I call them superpowers, is that we're able to read people better than just about anyone else. Right? We can walk into a room and I can tell sort of the energy level and like the intent of most people in that space, because I've had to learn that in order to survive. Right? But that also means that outside of my trafficking experience, I can't always turn that off. And so we continue to do that with providers and everyone in our lives until we don't have to, which means that if you are having an off day, if you have had a bad breakfast and you are frustrated with the patient or client that came before me, I'm going to know that about you, right? And I may be able to say that has nothing to do with me, but I may not. And so being upfront, right? And I'll say that to the young people I work with, like, man, it's been a long day, and I'm really glad that I just get to be here with you, right? Or if it's been a really long day, I need to take a couple deep breaths before I go into that space with another human. Because that human who has had to develop skills in order to survive, they're going to read everything about me, right? And so that transparency is important for that reason, so that I'm not having to figure out what's going on as I go, right? If I mess up, if I say something that's harmful, obviously unintentionally, I have to own that, man. And what that looks like with the young people I work with is something like, man, I really could have said that better. Can I try again? Right? Do I have your permission to try again? Because my intention was for not to come out that way, or that not to land that way. And I'm going to own that. As someone who has experience with a third party exploiter, I was told and conditioned to believe that everyone I interacted with wanted something from me, that they didn't really care about me, that you were just a number, you were just a kid, no one was going to believe you. And so how I operated was I looked for validation of that, right? And anything anyone gave me solidified what he had told me. So when therapists were, very vague, but they said things like, I'm here to help you, right? Or I care about what you say. But then maybe their actions don't really demonstrate that to me. I'm focusing on that. That's going to be my takeaway. So what's important to sort of respond, and how you can help buffer that is by setting really clear boundaries, right? Here are the hours when I'm available. I can answer your call between 9 o'clock in the morning and 5 o'clock in the afternoon. If you leave me a message, I'll probably get back to you within about 48 hours. So that if me, survivor, calls you at 6 o'clock in the evening, I know you're not going to answer. And I also have a timetable for when you're going to get back to me. And then if you have set those clear parameters, you need to respond that way, right? Because I am looking for ways that you're going to let me down. I'm waiting for that. And if you do that because you are human, then own it. I'm really sorry that I didn't call you back. My voicemail says I'm going to call people back in 48 hours, and I messed up, and I'm really sorry, right? No excuses, just sorry. I'm going to do better. right? Or here's my new boundary, because maybe 48 hours isn't going to cut it, right? But being real, and that's what that looks like, right?
Is there anything you want to add to this one?
And I think the only thing that I would have to just add is the fact that transparency does lead to trust, and it does lead to the ability to start to build that trust process. And I'm just so grateful to what Evelyn and Rachel have shared. Just a really personal example is one time I went into therapy with my therapist, and I could tell that something was off, and I could tell that they were not on their A game, and that's totally okay. But just like Rachel, like I took it really personally, and I was like, is it me? Is my story too much? Maybe I should actually go ahead and cut this off before like I get hurt. And so maybe like I won't come next week, kind of thing. And then my therapist was like, so you might notice like I'm a little off today. And I'm like, oh yeah, like definitely. And they just continued to share that they had a headache and that they've taken medication and that they're okay. Their headache is going to be fine. And that they're here for me to be present with me. And that then calmed all of my fears and all of those internal messages that I was feeling. And so just another way of how that might play out, another way of how we as clinicians can go ahead and show up for clients and help build trust and help by our transparency, help individuals to feel safe in our space.
Authenticity, being an authentic person and showing over time. So understanding this is going to be an issue, it's going to be a barrier, we can just expect that, and we need to take the time, and here's some of the things that we can do. So say what you're going to do and do what you say you will. I think just like straight up being a predictable person, showing up repeatedly and consistently, and being emotionally consistent too. Having clear communication and healthy boundaries, making sure that you know that the youth know what to expect and have the information that they need around issues such as mandated reporting, so that they can make the decisions about what they will and won't disclose. And then that transparency just being really straightforward, and being human and acknowledging mistakes. I think we are all going to make mistakes as therapists, and it's such good guidance just to own up to it. So I love that. So the next area is peer support. So a trauma-informed approach recognizes that peer support and mutual self-help can promote healing. Peer support may come from other youth or adults with lived experience through group opportunities or mentorship models. And family members can also provide peer support and mutual self-help to other impacted families. So thinking broadly about this. This is an interesting category as therapists, as clinicians, how to consider incorporating the idea of peer support into our work. So we'll just be thinking creatively about this. But Rachel, maybe do you want to talk a little bit about this? First, why is peer support important for youth who've been impacted by trafficking? And then what recommendations do you have for therapists in thinking about peer support?
Sure. I think so many of us, just sort of from my provider hat on for a moment, I'm thinking about how so many of us are trained to, or very much have to operate in silos. Right. So the work that we do is very individual, and certainly in therapeutic settings, it's designed to be individual for privacy. Right. But we don't, that's not who we are as humans. Right. We don't live in silos, and we don't heal in silos. So creating that network, creating that community for survivors is a harm reduction skill. Creating more spaces where you are not the only one who we have to rely on is really safe. That's really safety, right? So if I've been, and I shared a little bit about, sort of the conditioning that I experienced as someone who had experienced the third-party exploitation, I came out of that with an idea, a worldview that no one was safe, that nowhere was safe. And so the more people, the more communities, the more spaces I had that felt safe and supportive, that creates a safety net for individuals. And so as a therapist, as a provider, we need to resist that urge to feel like we're the one person that can help someone heal, because we're not, right? We're not doing the healing, right? We're just creating containers where people can do that safely. And that survivor in front of you already has all the skills, all the strength, and deserves all of that respect, because they've made it that far, right? And they can do the rest too. And you're someone to be part of that safety net, but you can't be the only one to do that, because that's not a net, you know what I mean? And so I think looking for other spaces, getting a little creative, what might help this individual? And certainly, you know, we think about other lived experience experts sort of joining in our part of the country. In Massachusetts, we have some really, really fabulous organizations that are peer-to-peer support, you know, people with lived experience, mentoring young people who are experiencing trafficking. And that model is not meant to be therapeutic necessarily, although we do have therapeutic supports to connect these young people to. But it's a space where the young person just gets to walk in and know that the individual they're working with gets them on a level that no one else could, right? And for someone who's experienced trafficking, we operate sometimes, or I can speak for myself, operated much of my life thinking, I'm the only one. Like, there's something wrong with me and I'm different because no one else I know has experienced what I've experienced. But when we find spaces where we exist, right, where other survivors are, where other survivor leaders are, that gives us hope. This isn't going to be the only part of my story, right? There are other things that I can do and be and all of that. And while we need all types of professionals to help us access, things that are going to help us heal, we need a lot of different things. And so being open to allow that young person to tell you what might be helpful in this space. Is there anyone you feel like bringing into this space? Is there anyone that we want to talk about and work on those, like sort of role modeling those relationships here? All of those things, because it does take a village, you know, that adage isn't there, you know, just sort of randomly. It does take a village, and we deserve a village. And you being part of helping us to create that village for ourselves, is more important, I think, than I could probably express or articulate. But I would really encourage you to sort of look outside the box. How can I engage with other communities, other services, and then how can I build relationships for the young people I'm working with to trust those people too?
Jess or Evelyn, do either of you have anything you want to add to that?
Yeah.
Oh, go ahead, Jess. Jess, go ahead.
Jesse, you want to go ahead, and then Evelyn?
The joys of not being in the same room. So I think some of the things that are just coming to my mind are the ways that we hold so much power in being able, as we get to know the youth that are seeking out services, to get to know the people that are important to them in their life. So getting to know if there maybe is a safe adult that they respect or that they've had a relationship with. So maybe it's a mentor, maybe it's a teacher, maybe it's somebody else, but then utilizing that to keep in a way that capitalizes on that relationship. So I might go ahead and, after a really hard session, maybe even ask them to go, like, when you think about that person who is so meaningful to you, and they don't necessarily have to have that person in their room or even have a very close relationship to them in that moment, but I invite them to think about that relationship and think about, how did that person make you feel? And what is it like to just capture that feeling right now? So that's like one thing that I have found to be beneficial, but also to being able to talk about belonging and talk about the grief of not feeling like they have a place to belong, talking about the isolation that they feel that their trafficking and exploitation has created, and then talking about different places where they can belong, or what it's like to find belonging within themselves. I think getting connected to other people who have lived experience can be really powerful. And as a clinician who's also a lived experience expert, I think I'm able to have different conversations because of my lived experience that might take years for you who are listening, who are working with trafficked youth, to maybe have. And that is something that I do acknowledge and hold space for that. But being able to really understand and find places to belong. I love also to animal assisted therapies and bringing in an animal as a peer support. Peer support could also look like bringing in a favorite stuffed animal. So there's different ways to have peer support that isn't necessarily like me bringing Evelyn into my therapy sessions and go, hey, Evelyn, do you want to go to therapy with me? But there's other ways to go ahead and bring in that peer support. But Evelyn, what were you going to say?
Trying to unmute. No, Jess, I mean, you touch on it very well. And I think Rachel also touched on it. Just the importance of community. You know, I mean, peer support is so important. And, you know, I like to use my experience. I know that it feels good. I think, Jess, you mentioned like just belonging. You know, at times you feel like when you're in your trafficking situation, you feel like you're the only one. There's nobody that can understand, you know, what happened to you, where you've been to, and things like that. And even though you do have a therapist to talk to, but you still feel like they don't understand, especially if the therapist did not experience what you have experienced. So having that peer support is so important, because I just remember when I met with other survivors that share similar story like mine. I didn't have, I wasn't going to therapy at that time, but when I met them, and I was just like, oh, wow, our story is so similar, just to talk to, because in my own community, like the Cameroonian community, I used to feel alone. I used to feel like, oh, I'm by myself. But it was so great to just have this network of survivors that share the same experience, that understand what I've been through, especially someone that was also from another country that was trafficked from their country to the US, and just have that support system was so great. I met an amazing, I call her my Asian sister, like Imamatu. It was like, wow, our story is similar. Even though you're from Indonesia, I'm from Cameroon, but we're both survivor of domestic servitude. And it was so just great that we can talk, we can support each other, not only by talking, but we're able to also support each other, financially, because we understand what we came from. So it is so important to have that peer support and build a community for someone that understands where you're coming from.
Yes, it's so important. You're just highlighting that need for sources of support and sources of connection, and that therapists really need to be collaborating as part of a larger team. I think that idea about not being in a silo and recognizing that it takes a village is a great one. And therapists like preparing that in advance. So developing those community partnerships, getting to know those programs, recognizing programs that are trauma informed, so that when you're making referrals, they're good referrals. That's all a super important part of this. So thank you for that. Our fourth principle is collaboration and mutuality, and it's emphasizing the leveling of power differences and shared decision making. So our questions on this one have to do with how might a therapist convey a sense of collaboration rather than, so that's doing with rather than either doing to or doing for youth and families impacted by trafficking. What could be the attitudes of an attitude that's more authoritarian or prescriptive, imposing rules and methods on the youth versus collaborating? And then what are some examples of collaborative approaches that a therapist could use with youth who've experienced trafficking or exploitation? So Jessa, do you want to start us off here?
Sure. So I really believe that it is important to have a holistic philosophy of how we engage with clients, and really knowing what your philosophy is and theoretical stance is before you go ahead and start working with clients, specifically youth who've experienced trafficking. Any professional relationship does have a power dynamic built into it. And that is not just because of education and licenses, that is just because of the role that us as providers have. And so my question would be, like, how are you intentionally taking your philosophy of treatment, your philosophy of healing, and also to your theoretical stance, and utilizing that in a manner to go ahead and minimize those power differentials? And so just some examples are when we use very directive type therapies, for instance, like CBT, that can be kind of that can trigger the youth that we work with because of how direct it is. And yet being collaborative is helping them to go ahead and empower them in directing their own healing process. And so I very much am a person-centered clinician, but being able to allow that youth to learn how to enter into that space and co-create the therapeutic process for themselves. Something else that I do quite frequently is go ahead and I sit on the floor with a lot of my youth that I work with. And that is because even though I've been very intentional in how my office is set up, when we sit on the ground together, we are sitting on the same grounding. We're sitting on the floor in the same plane together, and we are we're in that space and kind of like co-creating this space on an energy level. And so that's just something that physically that I am intentional to do. But then also too, thinking through how we go ahead and engage in the room, like how we even come out, how we even dress. When I know that I'm going to have youth who've experienced exploitation in my office, I'm going to dress down and I'm not going to wear very fancy clothes, and I'm going to be comfortable, and I'm going to invite them to come in comfortable too. And that is something that helps create emotional safety, to talk about those harder topics. Another thing is being able to go ahead and think through and define for yourself what collaboration is. And I think different people have different perspectives on what collaboration means. I see collaboration as coming together and creating equity and equality. And so being able to think through that and define that for yourself helps you then to begin to think about what that might look like with a youth who's been exploited.
Rachel, you want to add a couple thoughts?
Yeah, I think, the idea of collaboration and mutuality first starts with an awareness that like it's a team effort, right? That there's nothing as a provider that you can like do for or give to this person in front of you that they don't already have themselves, right? So there's a respect there that we've talked about before, that like it is not because of you, or it is not you that's helping to facilitate this healing and change. You're creating the space that allows that. You're providing, different perspective and input in a different way that like we can't always do for ourselves. But first and foremost, there's that respect for the human that is in that space with you. I think also, as someone who began my career as a crisis intervention counselor, we talked a lot about empowerment. What does empowerment mean? What does it look like? But I think something that I really want to point out for a moment is working with particularly young people, youth who have experienced trafficking, is that what empowerment sometimes looks like can be really scary, right? So if I come into a space and someone tells me, you get to make the decisions about everything that happens in here. You get to decide what you want to talk about, what we talk about, what we do. Part of me might be like, cool, I've never had that kind of power before. And the other part of me be like, what does that mean? Because I've never had that kind of power before, right? What might that look like? So for the young people that I work with, I say something like that, like in here, I'm a medical provider. So in here, what that might look like for me is, in here, you get to be my boss. right? I can tell you what I think, it might be important because I'm a nurse practitioner, but you are the expert in here. It is your body. So you get to tell me what happens, right? And that can look like, and then I give some examples, right? Because we want to empower folks and we want to do with rather than doing for or doing to, but sometimes we have to give examples of what that might look like, right? So for example, let's say I'm a therapist, but I know I have 12 sessions set up with this human that I'm working with, right? I'm going to be transparent about that. Hey, you and I have 12 sessions to work together, and maybe we'll get more, but maybe we won't. But here's where we're going to start: 12 sessions, right? And they might look something like, we might start every session with like a little check-in. What'd you do last week? How are you? And then you get to choose what you want to talk about that week. Here are some examples of what people in this space talk to me about, right? Keeping it pretty vague. Right? So the person's like, okay, I could probably do that. And here's how we'll wrap up every session, right? So sort of a prescription of sorts of how that interaction could go, because then that individual can think, okay, I can do that. I can do that. I also know now that I only have 12 sessions. So maybe I want to talk a little bit about one of my traumatic experiences, but maybe I think I'm going to probably need like 6 or 7 sessions to feel comfortable talking about this other thing. So maybe I'm just going to table that for now. That's what that looks like when we allow people to make decisions about their care, is by giving them sort of the parameters, giving them the container, helping to create that with them, and then saying, and then you get to decide what feels good, what feels safe, what feels okay, right? And having that be consistent too. So you can see some of the topics we've already talked about, they all sort of come together in every one of those moments. You can't have collaboration and mutuality if you're not actively trying to create spaces that are safe, that are and trying to present yourself and be a trustworthy person. So all of that comes together. And I think, I can speak for myself. One of my survival techniques was to create spaces where I got to prove that you were not trustworthy. So I would test. Some folks call that manipulative, and I hear that word about young people all the time. That was a survival skill, right? I wasn't trying to hurt anyone. I was trying to protect myself. So that's a skill. But what helps to sort of combat that is by being consistent, telling me what the rules are, telling me how things could go, giving me agency to make those decisions for myself with a little guidance, because I can't just walk into a space and someone's like, hey, you get to say how this goes, right? I still have trouble with big decisions like that. Hey, what do you want to watch? I don't know. There's like 5,000 things to watch on TV. I don't even know how to make a decision that big, right? So we could do A, B, or C. What feels good to you, right? Here are some things that young people in this space talk to me about. Any of that feel important to you, right? Just some examples, right? And so I think for me, that's what collaboration looks like. Not just like giving the reins to someone who has never had the reins, but by saying like, you do get to control that, and here's how it can look. Here's some things you can try on.
Yeah, I love that. And I love that the idea about building in kind of an efficacy around decision making so that their success experiences, like, I can control my life. I can like lead my future. And here are some ways where I'm building confidence in that. So love these points. Therapists really needing to be intentional about how they're minimizing those power differences, even as simple as, Jessa, your idea about sitting in different locations, whether you're switching chairs or you're both sitting on the floor, you're just doing something different with the space. Providing those structure and the options, but encouraging collaborative decision making, and that being a way to support a positive working relationship with the youth. And then collaboration, not just around concrete decisions, like whether or not to invite a family member into the session or not, but also working collaboratively around things like effective pacing and co-regulation, like the youth being able to say, oh, that's too much, like slow down, or this is really boring, we're not getting to anything. That being a collaborative process too. So great ideas. And excellent point, Rachel, that so many of these are interrelated. This one is, again, very related: empowerment, voice, and choice. This is a really important principle because obviously trafficking inherently involves coercive treatment that impacts young people's voice and choice. So a trauma-informed approach recognizes that and works to foster youth empowerment. It's recognizing that the young person is resilient and building on their strengths, and that the provider is not a person who creates the recovery, but a facilitator of the recovery. It's an assist. And so with this approach, the provider can support the youth in building self-advocacy skills and support them in setting goals and making informed choices. So let's go to some of the questions around that. Maybe we can start with you on this, Evelyn. So sharing a little bit about some of the potential impacts of trafficking and exploitation on youth empowerment, voice, and choice, and also maybe highlighting some aspects of the mental health system that can leave youth feeling disempowered, and how therapists might be able to negotiate some of those realities of care most effectively, and any examples of how a therapist could approach their work differently to support youth empowerment. So Evelyn, we'll start off with you.
Yeah, I think Rachel really touched a little bit on this. I like you mentioned, every title that we mentioned, they kind of connect together. The one important thing that I want to say is that empowerment might look different for different folks. And I think, Rachel, you did touch on this a little bit. Empowerment to me might not be the same for Rachel or Jess, and as someone that, is a migrant from another country, I know we're going to touch a little bit on cultural, understanding, but it is important to understand that when you're saying empowerment, how does that look for someone that does not look like you if you're the therapist? How do you think, and then also just trying to remember, a lot of the time as therapists, I feel like sometimes therapists, they just talk, they give suggestion, they don't do the ask. It is very important. That goes back to collaboration and trustworthiness. The big thing is ask them, especially if you want to help them through their healing journey and you want to empower them. Ask them, what do they want? How can we work together to get to the place that you feel empowered, and giving them the choice to say, this is what will work for me, because what may have worked for your other patient might not work for me. Your recommendation might not work for me. So if you think that, oh, these are the things that may empower you, that might not be what will empower me. So for most people, especially youths of trafficking, some people might think that, okay, being empowered might means, oh, your trafficker is in jail, you should be happy. As a therapist, you might ask that question: are you happy the person is in jail? Are you happy that they got justice? That goes back to also justice. That was not justice for someone like me that was taken at age 9. For me, justice would have been, empowerment would have been to reconnect with my family, to be able to talk to my family, to talk to my family, or just go back home. That would, for me, I probably would have felt empowered. So we really want to give them the choice as it stays here, and also just really do that ask. It is important to just have that ask, like, hey. And then also when you're doing the ask, make sure you're listening to what they are telling you that they need. If they're saying this is what will help me to be empowered to share my voice, have that listening ears.
You want to add to that?
Jess, did you want to add something?
Oh, thank you. I had trouble hearing you, Elise. Sure. So I think so much of empowerment, and like it's been stated, these are so interconnected, but so much of empowerment can enhance emotional and physical safety. And so I really think that this goes down to giving clients and giving the youth that we work with the permission to say no. And that can be so scary when no has been taken away from you, or when no has been used against you, or when no is something that you've been taught not to say. Being able to say no in the therapeutic space can be really challenging. And yet that's something that we need to honor. And I even will go ahead and tell clients, it's okay for us to honor the way that your body is feeling right now. Or it's okay to honor that you're not ready to talk about this right now, and it doesn't change the way that I see you. And I'm curious if there's another topic that would feel better for us to talk about. And so giving that permission, but also giving permission to go ahead and share their voice when they're ready. And so I oftentimes have nonverbal ways to share voice available in sessions. So even the other day had an exploited youth go ahead and use a marker and paper to go ahead and respond to the different things that we were talking about. And that was really powerful for them to communicate in that way. It could also look like using Sandtray to put their voice in through a Sandtray demonstration, going ahead and being able, I have doll houses in my office. I have that's another way for them to use their voice. I have done cameras with different clients. So I have different cameras that are available that I lend out to clients. And I go, this week, would it feel comfortable to go ahead and not take pictures of other humans because consent is important? And yet, could you maybe share what you're feeling and experiencing in this situation that we've been talking about through photography? And it's really profound because, like, when they come back the next week, like, we can look at pictures of a dark sky, or even like a picture of just being outside and it's so dark outside, things like that pictures can share so much that somebody struggles to put into words. And so being able to provide different ways to communicate. Another thing is that I love celebrating with clients. And this is something that I've had my own therapist celebrate with me. And I think us celebrating with clients can be so profound. And so, like, donuts, I brought donuts into the office, and it just being able to go, like, that was really hard for us to have such a hard conversation, and you've done such great work. Let's celebrate the courage that took. And a lot of times, at least for me, I had nothing celebrated. And so by creating moments of celebration, you're creating memories, positive memories, and you're creating positive associations to the therapeutic process, which is so vital in one's continued healing. So those are just some things that I have found helpful. But yes, thank you.
Right. Do you have any thoughts to add?
Yeah, I think I also want to highlight that sometimes the spaces that we find ourselves working with young people are very much not by choice, right? So we work with kids who are mandated to come for therapy, or they're in a residential detention center and we're engaging with them in those spaces. So there is no choice necessarily to, like, be there, right? They have to be, and I think that's real. And we want to, and I think we find ourselves in those spaces, statistically speaking, more often with young people who have experienced trafficking because of the forced criminality that goes along with the trafficking experience, right? And so when you are in those spaces, I would point that out, right? You don't have to be here, but you might not want to be here, but you have to, right? Somebody made that decision. I don't believe in people making those decisions, but, like, we're here, right? We've got 50 minutes for the next 12 sessions. We might as well use it. How do you want to use it, right? Because in my experience, the people who are in this space with me, and I know for me, like, this could be a good thing. Like, maybe there are things that you want to talk about, and, like, you have to be here. So we might as well, right? Might as well. Where do you want to start? And really acknowledging that, like, you don't have a choice to be here. And I don't love that either for you, but how are we going to use this time? So I just wanted to sort of throw out that, like, realistically speaking, sometimes this is very much not a choice. Even not even just a hard choice. It's not a choice.
Yeah, so finding those places where they do have choice in a larger context where there are limitations on that. Yeah. So a lot of this, I'm hearing, like, that idea about information as being power. Like, knowing what to expect, knowing, you know, the guidelines, and then being able to have some sense of control over their involvement in therapy, from like understanding what it is, how it works, if you're making referrals, the reason for referrals, what they can expect from you. We talked about that a little bit with trust as well. And I think one of the things that can be so challenging as a therapist is to see a young person that you're working with make choices that really worry you. And at the same time, to support this principle, it's important to recognize and respect youth voice and choice. So, you know, that's something that we've struggled with the idea of safety. I think that will come around again and again. How do you wrestle with supporting safety while also supporting youth empowerment, voice, and choice? It's a dilemma that I think we're all working on. And just being creative in how you support youth empowerment, even with small but repeated opportunities for the young person to express their own perspectives and make choices for themselves. So we're looking for any opportunities that we can have on building this. And then the last principle is culture, historical, and gender issues. And this principle really emphasizes provider awareness of cultural stereotypes and biases that the young person might have been exposed to regarding aspects of their identity, things like race, ethnicity, sexual orientation, and others, as well as the role of historical trauma. It encourages cultural humility and cultural and gender responsive services, including recognition of the healing value of traditional cultural connections, which is an interesting place, I think, to explore. So questions for all of you. So what's specific to the trafficking here? So why are biases and stereotypes particularly harmful for youth impacted by trafficking? How can therapists increase awareness of their own implicit biases and challenge these biases? And then what recommendations do you have for therapists who are working with trafficked or exploited youth with diverse intersectional identities, some of which might be common identities with the providers, and then others which are different? So Evelyn, do you want to kick us off here and talk about this one a little?
Yeah, so I'm so sad that Nathan could not join us. So I'm just gonna focus more on the cultural piece on it. So maybe Rachel and Jess, if you guys want to add like the gender issue and the historical part, that would be great. So just to your question, Liz, again, before I do recommendation, I just really echo the importance of cultural understanding. And as you know, the question said, there's always a lot of biases. When it comes to therapy, I always say that I didn't even know what the heck a therapist was. You know, it is important that if you're dealing with someone that might be from a different world than the Western world, most of the time we don't know what a therapist is. I remember in my situation being in foster care, coming here at age 9, and I was asked to go talk to someone. I literally didn't know that they didn't explain to me that I was going to see a therapist. I don't even know it was a therapist or a psychology. I don't even know who the person was, but I know just go to that person and talk to them about your problems. You know, so it is so important that if you have a client that might be from a different world than you are, especially speak a different language, that you help them to understand what a therapist is and who they're going to go see, and how that person can help them with the fact that they've gone through this traumatic, experience. Because, I went and I saw this therapist, and I just started talking to I think it was a man, I started talking to him. I was literally crying. And, first thing, he didn't even know what trafficking was, back then. He didn't understand it. And it would have been good that the therapist also understand what trafficking was, and also understand that it do happen from people from different part of the world. And then to also have that cultural background. I know that we all cannot get, we cannot learn all the languages, because I don't speak all the languages, but it is so important as a therapist to just have that cultural understanding when you're dealing with clients, because you are going to have clients from different backgrounds. So, you know, it is so important that you get that training. I hope they do that training when it comes to that, because, you know, I might be saying things, or you, the therapist, might be doing things that I might see that is offensive, you know, coming from where I come from, you know, and that's why it goes back again to, you know, to what we mentioned, you know, collaboration and the trustworthiness. And I think I stated, like, just the ask, you know, just do the ask, especially if you notice I do have an accent, which I do. It's like, try to get me to understand. Don't push your Western belief on me. Don't get me to try to go, because a lot of the times I'll give an example. I think the therapist, when I was crying, he just prescribed a medication, and that medication got me more depressed. You know, it made me more, you know, I cried more than ever. And so that's why it is so important that you, the therapist, I'm the client, but we work together. You do the asking. That way we can miss some of the stereotype and the biases. And again, just have, for me, I always say, just do the asking and ask them what they want in order to help them with their healing journey. And what I would recommend is, you know, honor the diversity, but definitely get training, especially when it comes to youth. As you know, there's just a lot going on with immigrant youths that are being brought to another country and are forced to work in the United States, and you don't know the type of trauma they have faced. So if you're going to have a client that is a youth that has happened to, try to learn and get training of cultural understanding. That way you cannot be, you know, you cannot be trying to put to them. I don't know how to explain it, but maybe Rachel and Jess can elaborate more on that. You know, as most of you know, English is my second language, so I'm working on it. But if I stated something that you didn't quite understand, you can ask me. So I'll give it to Jess if you want to elaborate a little bit on that.
Yeah, thank you, Evelyn. And I'm just so grateful for you and your perspective. I think from a cultural side, when people look at me, they also too don't know that I also too am from another country and was trafficked into the US. And there is such a historical element to my victimization and to the traumas of my life, and that I carry apart from my trafficking. And then there's the gender side. And a lot of times too, like when people look at me, they also too don't know how I identify on a gender perspective. And so I think being able to go ahead and move away from our biases by growing in our own self-awareness, by working with consultants, by working with supervisors, by getting training, as Evelyn said, in cultural identities, asking clients how they identify culturally and what are their identities. And so if somebody were to ask me what my identities are, I would share that my family, I was born into a first-generation Canadian. I am first-generation Canadian, but into a family that a second, third generation Holocaust survivor, and I identify as being queer. I'm an immigrant to the US. And there's so many other layers to how I see myself and how I identify. And by us as clinicians, inviting clients to go ahead and share by our paperwork, by even asking, like, just like Evelyn said, like, get to know me, like, ask questions. If you have questions, go ahead and ask how I, like, where I came from and how I see myself. I think part of creating safe spaces, and this goes back, and this is how everything is just so interconnected, but by us going ahead and asking clients how they identify, that means that we might need to share how we identify. And that can actually be a very beautiful process of creating safety and creating voice within the clinical space. So ask what your preferred pronouns are. Go ahead and have those on your email address. Invite people to go ahead and share how they see themselves, how they want you to see themselves as an individual. So being able I have a biracial client who I the other day just asked, I was like, so how do you see yourself as a Black woman, and how does your Blackness show up, and what's like, how do you, like, what do you want me to know about who you are as a Black woman? And she's like, I didn't know it was okay to talk about that. And I was like, I like would love to know how you see yourself as a Black woman. And that was just something that can be so powerful for us to invite those conversations. It's important for us as clinicians to stay up on the news. The news does impact our clients. And I know that during COVID and everything that happened with George Floyd, that created so much pain, so much trauma within individuals that I was working with. And by me staying up on the news, it enabled me to enter into those spaces with clients who were just so greatly impacted and affected. But also too, for my therapist to stay up on the news, because there's things that my body from an epigenetic perspective can feel. During COVID with the lockdowns, that triggered inside of my body things that my ancestors experienced during the Holocaust. And so just having that awareness and global awareness, go ahead and just be able to celebrate how a person is, and also to celebrate the changes that take place within that person. And as they get to know more of themselves, being able to create a safe place for them to share that with you is very vital. I think we need to expand what it means by culture. And a lot of times, the individuals who go through trafficking experience different cultural elements of their trafficking. So me growing up in familial trafficking, that's a very different culture than pimp control trafficking, than the labor trafficking that I experienced. And I bring, though, the culture of my trafficking experiences into the culture and into the identities that I embody. And so being able to have that awareness, and then also to being able to think outside the box, being able to look at how disabilities are also too an identity, and there's a cultural element connected to being disabled. And so just expand. We need to have greater expansion and understanding. But Rachel, I'm really curious to see and to hear your thoughts on this.
Just a few brief things I was thinking about as you all were talking. And Evelyn, I loved how you pointed out just becoming like culturally aware. What is important in other cultures? What are signs of disrespect or respect? And then also the humility to understand that you don't understand what it's like to live in the shoes of anyone else but you, right? And for those of us, just sort of speaking as a Hispanic female, I have not worked with a lot of therapists who looked like me. Which is like a barrier to begin with, right? And we talked about how that feeling of belonging and that feeling of identity, for some of us operating in this world, are our barriers all the time. And so then we come into spaces where there aren't a lot of professionals that look like us. And there are a lot of people on a day-to-day basis who make assumptions about who we are and how we identify. And then we have the culture of our trafficking experiences, right? So it's just sort of compounded identity crises sometimes, and like not having people who just get us in so many different ways. So also that humility to understand, please do your homework. Please grow a healthy respect for other cultures and realize you can't understand that perspective. And that is okay, because you can't, but you can be respectful of it. I think the other thing too I was thinking about is understanding your biases. And so I would ask all of you to sort of just sit there and think, and maybe this is easy for you because you already do this work, but when someone says human trafficking survivor, what are the images that come up in your brain? Who do you picture? What is their skin color? What is their age? What is their appearance in terms of gender? What do they look like in your brain? Because if a 15-year-old cisgender male walks into your space and you don't see that being an identity that's possible for a human trafficking survivor, then you're going to miss them, right? So really being not from a place of judgment, but from a place of, what are my beliefs? What are my deeply rooted beliefs? Not in a way that makes me a bad person, but because that's what I believe. what I've been taught to believe, what are those? We can't be honest about them until we see them. And so I would do those exercises with yourself. How would I describe that? How would I describe, a victim of human trafficking, right? Because I don't think there were many times in my life where I would have given you the opportunity to see me as a victim. So you would have missed me every time, right? And people did miss me every time. And so just being, what socioeconomic spaces do we think these people come from, right? Because we do that, these people kind of thing, because we're human. Doesn't make us bad people. It's so we can fit things into nice, neat boxes. But if we're going to do good work and we are going to sort of stop all of this stuff from happening, we're going to have to get out of our boxes and start thinking outside of our boxes, and realizing that, all of us have intersecting identities and deserve to be seen as those individuals, and deserve not to have our lives sort of decided by other folks, right? Those assumptions that can be really harmful.
So as therapists, we just need to be really, in an ongoing way, actively reflecting on our own assumptions and biases. Part of that's cultural humility, being aware of what we don't know, being curious, being open, being exploratory, and learning about other people's experiences and perspectives, and working to respond to each person based on their own experience and their own intersectional identities, which I think combats the experience of a lot of these youth who may feel other already. And so how do we foster that sense of belonging and community by just connecting on a human to human level as best we can? So our panelists, thank you to all of you. You all highlighted why these principles of a trauma-informed approach are so important for youth impacted by trafficking and exploitation. And you gave us some great concrete recommendations for clinicians and counselors. Now we want to share some feedback directly from youth who've been impacted by trafficking and exploitation. So we had a great opportunity last year to partner with My Life, My Choice. And there was a leadership opportunity for youth who are participating in the My Life, My Choice Leadership Corps, which is a summer program for exploited youth who are developing leadership skills. And we worked with the young people participating in that program over several sessions to reflect on their positive and negative experiences in therapy, which resulted in some of their recommendations for therapists. And they created this short video giving you all guidance on do's and don'ts for therapists who are working with youth impacted by trafficking or exploitation. I just want to note that there's a couple of moments in the video where the audio will cut out. The messages are written out on the slides, so we apologize in advance for that. But you will be able to see what everybody is saying. And this is about 6.5 minutes, so I will go ahead and play this for you.
Therapist do's and don'ts. Written by the My Life, My Choice Leadership Corp, summer 2022. In the first session, when you first meet us, ask me flat out what makes me feel uncomfortable and what makes me more comfortable. Keep checking by asking, would this make you uncomfortable? Starting off with easy things would be nice. Ask what my goals with therapy are and what I want to accomplish. Acknowledge that I don't have power to decide when I want to see a therapist and when I don't. That is hard. Where and how should therapy happen? An ideal therapist is someone who takes me out to see new places, the park, the library. I don't like to be in the same room over and over, the same walls, the same person, and the same questions. I prefer in person rather than virtual. If I cry, I want to walk with my therapist and be with them. At home, I can't really talk. It is too hard to have privacy. I actually like both virtual and in person. In person is preferred, but it is good to be flexible to do it virtual. Body language is a big factor. Some therapists don't know when to stop pushing, and some people don't know how to speak up for themselves. So body language can show when they are uncomfortable and need reassurance. Don't just take notes because it's kind of creepy. When therapists physically react to information that is too much, if you are having way more reaction than me, that is definitely a red flag. You need to have professional body language, You don't know how your client will react. Don't rush it. Don't try to get a bunch of information out of me right away. Just meet me. When you first meet therapists, they should be all ears instead of asking too many questions. Let you open up to them. Take it day by day. Time and patience is very much needed. Don't just jump into my trauma. Ask me basic questions. Play a couple games. Let me open up to you. Help me develop coping skills, healthy ones. Help me learn to self-regulate. Help me have the tools I need to help me calm down.
When I disclose something that has happened to me, please follow whatever confidentiality policy you said you will follow. I trusted you. We understand that you are mandated reporters, but keep confidentiality as much as you can. You don't need to share everything that happened in my day. Tell me how you will use the information that I'm telling you. Reassure the boundaries of confidentiality. Let me know where the notes will go. Oh, I'm sorry, that voice. Please don't talk to me like I'm a baby. Talk to me in your normal voice. Don't be condescending, like the way people are with pets. It's dehumanizing. Don't say I'm so sorry about what happened to you. I don't need people's sympathy. I need you to help me work with my emotions. Don't just pat me on the back. I don't like when people feel bad for me. It's uncomfortable. Just be straightforward and be real with me. I don't need your charity. I want someone to understand what I'm going through or I've been through what I went through. If someone feels bad for me, it makes me feel bad about myself. Please reassure me that what has happened to me is not my fault. When I choose not to disclose, that's absolutely a no-go. I will come to you when I am ready. Ask what I want to talk about today. Every day is different. Some days I need to vent. Some days I need to cry. Some days I don't want to do any of that. Give me the floor. Be comfortable with silence. Leave it for a little bit, then say something like, so do you want to talk about anything? Let it sit.
Disclose the bare minimum of information. Obviously, if something important has to be told, you just have that. But you don't need to repeat all the names. At the part time, explain the confident guidelines to my parents. Them down doing the work.
Some of us wanted the therapist to be direct, and others wanted therapists to follow our lead. I like it when therapists are real with me. I like to hear using kindness and compassion. You made a mistake. Why did you do it? I want the therapist to first ask me questions like, what did you think is going on for you? I don't want you to blame me for what I did because I just felt like a piece of shit. I want you to talk to me and steer me in the right direction to help me figure out my triggers. I don't just want to hear, I don't just want to talk about emotions. I want to talk about what I can do different. Note that I've had so many therapists. One leaves and then the next one comes. And then the next one comes. Please do a nice handoff if you can. It helps to have a new therapist in place so you are not leaving me without having one. Make the transition as smooth as possible. If I really like my old therapist, this feels really sad. This is a really big thing. Before you go, give me an overall recap of everything I worked towards and all the ways that I have succeeded. For example, say you got through this and this in our time together. You can get through this and this. Review those milestones. Ask if I'm ready to be done with therapy. Ask me, did I provide you with the tools to self-regulate?
Final words of wisdom. We are people too. We are not just your little kids. We went through this stuff and we deserve to be treated just like everyone else. We all need to be handled like glass. If we went through one of the most traumatizing things ever, we can handle whatever normal treatment you offer. Recovery is not a short process. It's not going to happen overnight. You push us to talk about something we're not ready to talk about. If you're impatient, I'm not going to open up to you. Time is key. Reassure me that it's not my fault and that things get better. Tell me that if this is rock bottom, I can only go up from here. Don't treat me like a baby. Don't be like a robot. Be understanding. Help me self-regulate. Sometimes I need you to just do something fun and be in the present. And sometimes I want to talk about the hard stuff. Give me the choice about what to talk about. Help me set goals about the issue that I'm talking about. Have a plan instead of just talking. I want to learn how to recover. We have gone through traumatizing things, but we are all really tough. Help me know that I am not my trauma. Every day is a new day and my life is not over.
Written by My Life, My Chores, Leadership Corp, Summer 2022. Thank you for listening.
We're so appreciative of these youth leaders and the collaboration with My Life, My Choice to be able to bring these recommendations to you. And we just hope it encourages you to challenge yourself to work in an ongoing way to offer more trauma-informed, survivor-informed services. So we just have a couple minutes for final thoughts from our panelists. We have a few questions. We're not going to have time for all of them. I will just raise one question, or you can give final thoughts. It is, how can you engage in conversation with young adults or youth when you notice that exploitation and trafficking has become the norm for them to survive and to support themselves? So I'm going to open it up to Jessa for thought either about that question or just a final thought. I'm going to go with Evelyn for a minute.
Okay. I'll do both final thought and question. So can you repeat the question again, Liz?
Yeah, the question is when youth are kind of in a pattern of exploitation or trafficking, and that's become the norm for them to survive and to support themselves.
Okay. That video, My Life, My Choice, really answered the question. So maybe whoever asked the question, we can share that video again. It goes back to everything Jess, Rachel, and I just did. And I think I said it, that you heard from the youths themselves, the importance of understanding that they're human. They're not robots, and they're not robots. Even though this situation happened to them, that is why it is so important to collaborate with them. It is so important in order to collaboration, ensure their safety, but not only that, also make sure that they can trust you, because in that video, they talked about how they can tell, the facial expression, because I think I said it earlier, like we can tell when you're bullshitting or when you're using some type of terminology words that we don't understand. So the importance of just asking the youths, and also just remember, as an adult yourself, you were once a youth. What would you have wanted when you were going through a certain situation? Even though this situation happened to us, it is so important to still have compassion to it and just don't do the talking, because that could really throw you off. But my final word is just, you heard from the youth, My Life, My Child. I thought that was a great video. And as a survivor of child trafficking, that became, a youth, I just feel like, if you're going to do this work as a therapy, I know you went to school, we have to go by the rules and book. It is so important to just have that human connection and be present, and also just have compassion, because we are sharing things that have really affected us, and we are going to be adult, and those things are going to stay with us. So just have that understanding, and most importantly, bring your human self into the situation.
Final thoughts?
Yeah, so I would just go ahead and say that no matter what one has experienced, that there is hope. And youth need to know that. They need to know that they can begin to make their own choices now, that it's okay to make choices, and that we can offer them hope and hold hope for them when that might be something that is so distant or so far away. And so by us showing up, by us being human, it changes lives.
Yeah, I think, I was been thinking about that question that someone posed, and I think there was a similar one in the Q&A about sort of watching things happen for folks and maybe not having an understanding or not knowing what to do, right? Even if you have an understanding of like, why does this keep happening, right? What is this theme that's showing up for this individual? If you feel like you have a good enough relationship, you could call attention to that, right? And with an understanding of every single time I engaged in that kind of behavior, it was for a reason, either because I had to, out of survival, or because there were so many other vulnerabilities that led me there in the first place, right? And so what helped me to replace my need or want for those spaces of harm was for other spaces that met those needs. right? Whether that was food or shelter or belonging or love or any of those vulnerabilities that made me susceptible to trafficking in the first place. The only thing that ever would have really combated that, and what ultimately did for me at least, were other spaces where those needs could be met in a healthier, in a safer way. So that's what I would start to sort of toy with folks if you're working with them and they're stuck in these cycles. That's a real thing. And that doesn't go away until there are other spaces that can start to replace all of the needs and wants and desires and all of it that those situations are meeting for that individual, right? So that's what I would leave you with.
That's great. And how can all of the people on this call be maybe part of some of those safe spaces? This brings us to the end of today's webinar. We'd like to thank our presenters for sharing their experience and insights, as well as all of our lived experience and mental health expert panelists who collaborated to develop the guidelines. And of course, thank you to all of you for joining us for this session of the Mental Health Treatment Guidelines webinar series. This webinar series is a resource for you and your colleagues. We welcome your feedback. To share your thoughts, please scan the QR code on the screen. You'll receive a certificate of attendance after completing this brief survey. To learn more about professional development opportunities with the National Center on Child Trafficking, including additional sessions of this series, please join our email list by scanning this QR code. We look forward to continuing this work together, sharing resources, and expanding trauma-informed services for youth and families impacted by trafficking. Have a wonderful day.